Welcome all of you. Good morning. Uh, my name is Taddessa Alamayo, as you see it in the board, and I am a medical instructor, and I am also a BLS CPR first aid instructor, and I'm certified from EMS safety. All questions are welcome. Bathroom is to your left and straight, and you will see it next to the elevator here in the second floor. And we'll have a 10 minutes break each time that will be provided during this course. So let's start with why are you here? Okay, maybe some of you can give your own answers. Okay, you might have different reasons why you come here. The commonest reasons are, one is from workplace, and one is sometimes your profession require to update that. And also some of you may want to gain knowledge on the CPR and BLS. Okay, our topic for today will be on shock and on adult choking. What do we learn here? We learn how to quickly recognize what a shock is, and if you have a choking victim, how you can help this victim, and when to call 911, and how to check a person for life-threatening conditions during shock, and how to start CPR. So these are the things that we need to learn today. Okay, so let's go to our shock topic. So you'll get it on page 13 of the student workbook, which is the first aid workbook. You will get it there, and we'll start from page 13. First, let's define what's shock. So shock means when a person doesn't have enough amount of blood to supply the body. Okay, the body is very important. Our body mechanism is so essential, how it's being made, and there are especially the most important organs that need blood supply. These are for example, the brain is very important, and the kidneys are very important. Okay, and the heart and all the organs, they need blood. But when there is poor blood supply to the organs, then we call it as shock. Okay, and usually, when there is a poor blood supply, what's happening is that there will be a poor oxygen supply also. Poor blood supply will lead to a low oxygen. Okay, and this low oxygen is what we call oxygenation. That is, the level of oxygen is what we call oxygenation. So you will have poor oxygenation in the tissue, so the blood the tissues, they cannot get enough blood supply. So shock is a life-threatening condition. Okay, that means it's very dangerous. If it's not acted early, or if it's not treated early, it can be a very life-threatening condition, and it can lead to a permanent damage to the organs. Let's say, for example, some tissues or cells, they don't get blood. What will happen? Then those cells and tissues, they die, and we call this in the medical term as ischemia, which is a poor blood supply. And when the tissues, they die, then we call it as infarction. So let's say if you have a brain cell damage, and then, or if you have a heart cells or tissues damage, then you can have that, and that leads to really very serious problem. So the goals of our first aid care is to treat any obvious cause of shock, you know? So it means there are some different causes of shock. So shock, it can be caused because of their cause. We can classify them into different kinds. It might be, okay, a little bit the terminologies. We have what we call hypovolemic shock. When in hypovolemic shock, when let's say the body doesn't have enough fluid or enough water or enough blood, that's called hypovolemic shock. This can happen, for example, in case of bleeding. You know, bleeding can be caused by what? By car accident, for example, and any pregnant lady who's at birth, she can have bleeding. So that kind is called a hypovolemic shock. And another one, because of heart origin, is what we call cardiogenic shock. Cardiogenic shock because of heart problem. And another is what we call neurogenic shock. Usually when there is severe pain, then it can lead to this. And when there is infection in the body, okay, a very serious infection in the body with a patient with a high body temperature, okay, and we call this as septicemia, and this is what we call septic shock. So this is septic shock. So this is because of what we call infection or septicemia, infection. And the other kind is what we call anaphylactic shock. Anaphylactic shock. This is because of a very severe or severe form of allergy. When patients have allergy, then that is when we have. Okay, so once we discuss on this, then let's go to how does we identify patients with shock, or what are the signs and symptoms of shock? I mean, some of you can give me some answers, for example, okay? So let's see that here in our book, that's on page 13. For example, patients might develop confusion. They might be confused. They might be delirious, okay? And they will be agitated. They will have dizziness, okay? They will be weak. They faint. The commonest thing is they faint, okay? And the color of the skin looks to be what? Pale, very pale, cold, clammy skin, okay? That's what they are going to have. And also, they will have extreme thirst, okay? They need really to drink more fluid, more water. And there is fast breathing and pulse rate. So the pulse is something that you count it here, okay? And that is also another. Then the other is unresponsiveness. They don't respond to anything, okay? So that these are the most important signs and symptoms. So shock is progressive, okay? So the signs may change as the person's condition worsens. Okay, that is what we do. So, what can we do with our care, or how can we care patients with shock? That is an imminent and most important part of our response to that. So the first thing is call 911, okay? And the second is lay the person down. So we lay the person down. Why do we lay the person down? Because in shock, all the blood supply will go to the body, so that we reverse it, and the patient needs that blood supply to the brain. And especially we have an important position where we can elevate the legs up, or if we have like a bed, so we can make the bed like slant, and like, okay, the head will be down, the head side, and here the leg side of the bed will be up. So we call this usually as shock position. shock position, or it's also called Trendelenburg position. So this is Trendelenburg position. This is used for patients who are in shock. Another is control external bleeding. If there is any external bleeding, then we control that external bleeding. Okay, how do we control it? First, what do? Compress the site of bleeding. Okay, elevate the limb and compress the site of the closest or the nearest artery, closest. Then you compress that, and then in some cases you might need to apply also the tourniquet. So maintain body temperature. How do you maintain? Give them more blankets, more clothings, and calm and reassure the person, and if any other one is around. And monitor the status. How do you monitor? Usually first see them, that is called inspection. Watch them, okay? And then try to feel them. How is their skin? Is that cold still? Is that pale still? Okay? And then sometimes if you can check also the pulse and the blood pressure. One most important sign that we see in shock is that there will be an increase in the pulse rate and the blood pressure drops. Okay, if there are like healthcare workers here, then you know that. Okay, especially the pulse rate will increase. That means it's called tachycardia. It will be fast, and then the blood pressure will drop. Okay, that is the commonest finding that we get. So if you can, wherever the setup that you have, you need to check this. So we learn on shock, and what do we see today? So that means shock is a very important emergency condition that we need to act as fast as possible. And shock is a decrease in the perfusion of the tissues. That means when tissues do not get enough blood supply, that is called a shock. Okay, and how can we cause the shock? How it can be caused? Because of poor bleeding, okay, or when there is a high amount of bleeding, when there's an heat emergency, in burns, heart attack, allergic reactions, infection, dehydration, okay, spinal injuries, all this. So they have these medical terms. If you want, you can get them. And what is the most important care that we do? Call 911, okay? And then lay the person flat, or if you can, do the Trendelenburg position or the shake position. And then calm and reassure the patient, maintain the body temperature, control any external bleeding, and monitor the status of the patient. Okay? So any questions you have? Thank you.